Good morning, everyone. My name is Lauren Myler. I am a licensed clinical social worker and also an oncology social worker. I am a psychotherapist in private practice, and I have training in cognitive behavioral therapy from the Icahn School of Medicine at Mount Sinai Hospital in New York City. Really pleased to be back again with Soft Bones Foundation to speak about a subject that's near and dear to my heart, and that is uh, dealing with the emotional effects of a chronic illness or disease. And this is a very different format. I'm sure it's very strange for everyone. I see that there's 40 people connected. Oh, I see one person on the screen. This is a very different way to present on a subject that involves uh, emotional illness and connecting with other people. It's very different. So first, before I begin, I just want to say hi to a couple of people that I see in the room, if that's okay. I see Amanda Baker, welcome. Chris Johnson, welcome. Uh, Debbie Aiden, welcome. So again, I'm going to talk today about the emotional effects of living with a chronic disease or an illness. And the overview of my presentation is that I will talk about how emotional distress is often present in patients who are diagnosed with a serious illness or medical condition. This can include anxiety, depression, medical trauma, or PTSD. I'm also going to talk about pain management and desired outcomes for the patient as it relates to identifying issues related to pain and how we can provide the most comfort for the patient. That's a subject that could really encompass quite a bit of time. I'm going to just provide an overview. I'm going to also talk about the really important role of caregivers. I will also address how to develop a coping toolbox, what that would look like, and how to create a toolbox that is appropriate for you. And at the end, we'll talk about how do we decide when and whether we need to seek help with an emotional concern. So, what are some of the feelings that are associated with being diagnosed with a chronic illness or disease? Many of these are sort of more obvious than others. Feelings of anxiety, fear, uncertainty, anger, and sadness, intense feelings of guilt and shame. What did I do? Why did this happen to me? Feelings of hopelessness, feeling like there's no one to talk to or anyone who will understand, that sense of isolation, and grief associated with thinking about what your life was before and now what your life may be now that you've been diagnosed with something serious. Um, so, researchers and professionals in the field have identified uh, three core areas that patients with a chronic illness or diagnosis seem to present most often with. Those are anxiety, depression, and what we call medical trauma or PTSD types of symptoms. And this is just a shot of what anxiety may look like. You may be scared, you may feel chest pain. It's that feeling of fear, heart palpitations, sweaty palms, just a irritability. So with anxiety, there's just this general sense of uneasiness, difficulty being calm or relaxed or feeling calm and relaxed. Um, being sort of overwhelmed by uncertainty about what the future holds and what is my life going to look like. Sometimes we get panicky. We don't know what to do. There's so much to parse through that we get really overwhelmed. It can impact sleep. We can have disruptions that are related to insomnia or an inability to sleep, or uh, or depression, where people sometimes sleep too much, which leads to fatigue. Physical symptoms, again, cold, sweaty hands and feet, shortness of breath, maybe heart palpitations, dry mouth, stomach upset. The second one is that we've identified as being very common when you're diagnosed with something serious is finding yourself in a depressed state. And the primary symptom of depression is a loss of interest in everyday activities. So those things that you would normally do when you would find enjoyment and enthusiasm and you would engage in, you find that you really just have lost your desire or interest in doing them. Very common is difficulty regulating emotions, feeling particularly emotional, crying perhaps more than normal. Um, and again, feelings of guilt and shame and thoughts of why is this happening to me? Uh, People can find themselves in a space of hopelessness, and that's very difficult and challenging for the patient to work through, while at the same time trying to address the physical aspects of your illness or disease. Again, change in sleep patterns, weight changes, perhaps difficulty in relationships. You become irritable, a little bit more difficult to be around. Perhaps, again, you become more emotional, and your partner or family member, your support network, it's difficult for them to know what to do. Uh, Also, decrease in attention and memory, being distracted more, and having more difficulty attending to some of the things that you would normally do if you were more clear-headed and not having to deal with your illness, and even issues with memory related to just being distracted and overwhelmed. And again, I mentioned medical trauma or PTSD. And what I want to say here is that uh, what you may have seen is there is some overlap amongst these um, emotional issues, or what we could call a diagnosis. Anxiety has certain manifestations that you may also see in depression, that you may also see in medical trauma or PTSD. Um, Specifically for medical trauma are things like flashbacks, recalling perhaps when you were diagnosed, or some aspect of the experience that took you back and created this feeling of fear and that overwhelming feeling of anxiety again. Perhaps nightmares, feeling you may feel alone and isolated because people don't understand exactly what it is that you're personally experiencing. And again, irritability and experiencing angry outbursts, feeling worried or sad, or something that we call white coat syndrome, which you may have heard that term, where prior to a clinical visit, you start to feel overwhelming feelings of anxiety and fear when you go to the doctor. And again, there's a lot of overlap. So it's really important, if you're experiencing some of these to a degree that it's really impacting your life day to day, that you reach out and try to get help to identify what it is that may be going on specifically with you. So a lot of ground to cover in a short period of time, but I'm going to touch on the subject of pain. Pain, again, is really the source of a lot of suffering for patients who have an illness or disease, perhaps soft those dealing with hypophosphatasia, perhaps if you're going through cancer treatments. And pain is very difficult to treat and can, because of that, become a very overwhelming and difficult uh, thing to move through. You're overwhelmed by many things, and it's very difficult to get pain under control. And there really is no test for pain. There are pain scales. So when you go to the doctor, the patient self-report, and the doctor or provider may ask, well, what's your pain on a scale of 1 to 10? And you identify what that is. And providers and physicians do the best they can to help patients manage their pain. But there is some provider physician bias. And what I mean by that, that's not to criticize providers and physicians. It's just that research shows that pain is often underestimated by healthcare providers. But when somebody in your family observes what you may be going through and they report on a patient's pain, it's often overestimated. So the challenge in pain management is trying to be able to work together with your provider to balance some of the concerns that the physicians and providers have about prescribing certain medications. Because of the opioid and fentanyl crisis, providers and physicians are they're very careful about how much, when, protocols of pain management. And this is an important subject because you really have to advocate for yourself and push to make sure that you're getting the proper pain management protocol that you need. And I would encourage anyone, if they are experiencing pain to a degree that they feel like isn't really managed as well as they would like, to bring this up with their physician or provider. But know that there are centers out there that actually do pain management and have experts in pain management who can help you to make sure that you get the proper protocol for you. Because even with the pain experience, there's a psychological component. And it goes back to what I've already discussed, which is that anxiety, the depression, the trauma. So it's really important to try to gain some control over that pain, or it will spill over into your psychological well-being, and it will have an impact on your physical health as well. And pain can really become the focus of your life. So it's really important to figure out how best to control the pain. It also leads to behavioral changes. You become less active. You may not get the exercise that you need, or it's really important to try to do your best to get yourself moving best you can, and it can impact your quality of life. And here's the desired pain outcomes for patients. We want to create an opportunity for routine and frequent assessment if you're having a pain issue. See your doctor on a regular basis, make adjustments, because the pain protocol that you started with may not be the pain protocol, sort of going down the road, because it may need to be adjusted based on the effectiveness. We want to maximize comfort for the patient. We want to identify realistic physical activities that patients can do given their pain experience and pain level. This is a little bit of a challenging one. Monitor thoughts and behaviors and make decisions about their workability in the moment. You want to have an awareness of what is going on with you in the moment as it relates to the pain, because you don't want thoughts about the pain to overwhelm you to the extent where it makes it difficult to function, because again, that leads to behavioral changes that make it difficult for patients to do things that they would want to do in their daily lives. And really important, if you are experiencing pain, create a pain log or a pain record where you identify the date, the time, the activity and what your pain is on a scale of 0 to 10. So that if you go see your provider or physician, you can report to them exactly what's going on to you, what's going on with you in any given moment. It's really important and really effective because you will forget when you go back to your physician and you won't know how to report that to them. I'm going to switch to a completely different subject, the extremely important role of the caregiver. Uh, Caregivers take on such a tremendous amount of responsibility in supporting the patient who has the chronic illness and disease. They escort patients to their doctor's appointments. They're present with the patient during tests, surgeries, or procedures. Those things take up an exorbitant amount of time. They can. CAT scans, multiple doctor's appointments. In the case of oncology, which is my particular area of specialty, patients have chemotherapy appointments, then they have radiation for several weeks at a time. So this is a real commitment of time and personal effort to support the patient and the person that they love so much. And it's really important for caregivers to be present because the patient is experiencing such an overwhelming, diagnosis that it's important to have that extra set of ears to make sure information isn't missed and is understood by the provider, physician, the patient, and the caregiver or family member or friend that also goes to the appointment. And the caregivers are constantly worried about the person that they love. That can be overwhelming for them. Sometimes caregivers can't work because there's so much time that's needed to support the person who is dealing with the illness or disease. And this can also lead to financial stress. And the caregivers are an integral part of making the important decisions as it regards the patient's treatment plan, to be there to support the patient and help them determine what the best path is for that patient. So similar to the experience that a patient would have, caregivers can have burnout, and that can also manifest in anxiety and depression, not trauma or PTSD, but really just feeling overwhelmed, feeling anxious, worried, and they can withdraw from their family and friends and really just focus on the patient and disconnect in some ways from other people, which is also important for their emotional well-being to stay connected. They may have a loss of interest in activities that they previously enjoyed. They may feel blue, irritable, hopeless, or helpless. They may experience changes in appetite, and they may have changes in sleep patterns, and that could result in their bodies breaking down and perhaps becoming sick more often. So what do we do? So I talked about a lot. It's a lot to sort of condense into a short period of time. And I know you're asking, okay, well, what can I do to best take care of myself? And we talk about coping skills and developing coping tools. And coping skills help you tolerate, minimize, and deal with stressful situations in life. Managing your stress well can help you feel better physically and psychologically, and can impact your ability to perform your best. The desired outcome is to reduce emotional distress. So you want to have, ideally, a coping toolbox, as I said earlier, that's fluid and dynamic. And what I mean by that is we feel differently every day. We wake up every day, our mood may be different, our experience may be different, what we have on our agenda for the day may be different. And that impacts us day to day. So you want to be able to sort of adjust what you need to do based on how you're feeling in a given moment. It's really becoming aware of what your personal experience is and connecting to that. And that's a skill that not everybody has, and it takes some time to acquire it and to really be able to know what be able to say to myself, today I think what I need is a walk in the woods, to just take in nature and just have some quiet time. And exercise is one of the most important things that we can do to make ourselves feel better. Emotion focused strategies, I break it out. Emotion focused and problem solving strategies, because the emotion focused strategies are what can we do to make ourselves feel better, what can we do to make ourselves feel better in the moment. And again, exercise is one of those that and it doesn't have to be rigorous. It can be a walk, it can be sitting and doing some head circles in a comfortable chair. uh, so there's many different things that you can do. Proper nutrition is extremely important. Taking a bath. I really believe in the soothing and healing effects of water in various forms. Either taking a bath, going to the ocean, going for a swim, being in the water, the sound of water, the feeling of water is very, very soothing and relaxing. And swimming is also a very low impact exercise that's very good for the body and the mind. Positive self statements. I say give yourself a pep talk. It's really hard when you're struggling with something serious to stay in a good headspace, I call it. And if you can be positive or say things, celebrate small victories that may have occurred in your day. Tell yourself, I did a I went for a walk today. That was really amazing that I was able to carve that time out for myself. Good for me. When we stay in that negative headspace, it has an impact and ripples across every aspect of your life. But it's not easy to do, especially when you're dealing with something serious. It's very difficult to stay in a positive headspace and say those positive self statements and be positive with yourself. It's very, very difficult. And again, that goes to developing tools, getting help if you need, and really listening to yourself so that you can care for yourself in the best way possible. There's a number of different modalities that are out there that help with this. Uh, I believe strongly in mindfulness meditation. That is, just sitting quietly, being present, trying to just focus on how you're feeling in a given moment. I think breath work is also great, helps with anxiety particularly. I think journaling is a wonderful tool for offloading, if you will, some of the things that are sitting housed in your mind. Uh, you may be angry about something on a particular day. Get it out. If you don't want to lash out at your family member, or your partner, or your support person, write it out. Write what's going on with you. Get it onto a piece of paper and out of your head or out of your mind, and let it symbolically sit in that space instead of staying housed in your mind. Reiki is a wonderful modality that is a relaxation modality as well as healing touch. Again, spend time in nature, listen to music that you love, play with pet. Pet therapy is wonderful for people who are dealing with a chronic illness or disease. And then I identify problem focused strategies, which are more related to how you structure your time. How do you structure your day? What can you do so that you can be the most effective? And one thing that's really important is knowing what your limits are and establishing healthy boundaries, because you may not want to go for a walk on that particular day or exercise, but your family member, your support person wants you to and thinks it would be good for you, but you're just not feeling up to it. So you have to be able to know your limits and establish your boundaries and communicate clearly to others what you need in a given moment. And people say to me, "Well, I don't have time to do that." And I always push back a little bit, because you need to carve out the time and make it a priority to take that time for yourself. And I call it take a time out. And the 10% rule is take 10% of the time of your waking hours and carve out that time for yourself. Do a meditation, go for a walk, play with your pets, cook in the kitchen, do something that you love, plan something enjoyable so you have it on your calendar, so you have something to look forward to, and manage your time well. Create to-do lists so you're not overwhelmed, because when we become overwhelmed, we become anxious. When we become anxious, we become depressed. And so it's all of these things kind of are work for better or for worse interchangeably. And one cog in the wheel might have an impact on another cog in the wheel. When do you seek help? Well, how do you know? You're feeling feelings and you're not really sure. You feel overwhelmed, but you're not sure if you could just address it with your primary care doctor or with the doctor who is your specialist who's caring for you. And what I would say is, if what you're experiencing is so overwhelming that you can't function and do your daily tasks of everyday living, then you may want to consider reaching out to a therapist. And ideally, somebody who specializes in treating patients who have a chronic illness or disease. Many of the large hospital systems, and I know Summit Medical Group, Morristown Medical Center, they have wellness centers now. I don't, everything is different now with COVID, which I haven't even talked about, and I'm not going to get into in any great detail. So I'm not sure exactly what is open currently within those hospital systems, but there are wellness centers there, and they offer healing touch and Reiki and restorative yoga and a multitude of things, massage and things of that nature. And I would encourage you also to find a support group. And what I probably should have put here also is create a support group. The one, I guess, plus side of this sort of platform is you can get people together from all over the world who share your same diagnosis, who understand what you're experiencing. The support of other people who understand what you're going through might be one of the most powerful things in the healing process. So I would encourage you to try to do that. And with any of these things, I can certainly be a resource to help facilitate connection to services and resources. And my contact information is here. Again, Lauren Myler. It's my email address and my phone number. And I've asked that my presentation be shared with the attendees. So you have my information. And again, it was a lot of information condensed into 30 minutes.